looking at is we're looking at the design of health insurance exchanges. And I kept to the 3-slide limit minus this title slide, so I apologize that I won't have with me as many screenshots as I normally do, but what I'm going to try to do is tell you about a series of projects that we have where we're thinking about how consumers might behave in exchange type settings and what implications that might have for policy for consumers and for firms who are participating in these exchanges. Okay, so I'm going to tell you about 3 projects. First is a short paper that just basically asks the question, are consumers really scrolling all the way through the website and making calculated decisions, as John pointed out earlier, we might expect econs to do, where what they're doing is they have a forecast of their expected expenditure, they have some level of risk aversion, and they're trading off the features of plans against their price. So we want to look for simple evidence that this may not actually be how people make decisions. So what we do is test a fairly straightforward heuristic. Do consumers overchoose the cheapest plan, which during the time period that we're looking at is listed first on the website, right? So this sounds like something we might see consumers doing if they're overwhelmed by the range of choice, or if they just don't want to deal with this and they just click the first thing they see. Alternatively, it might be what we would expect consumers to do if they're experiencing the kind of rate shock that Adam alluded to earlier. So lo and behold, we find that the cheapest plan, which varies in different parts of Massachusetts, I should say that we're looking at older data than you might imagine. So Massachusetts has had an exchange up and running for a number of years now. So we're looking at Massachusetts data. In particular today, I'll be talking about data from 2009 and 2010. So what we see is that the cheapest plan available to a consumer varies a little bit depending on which part of the state you live in, and that allows us to test whether or not consumers are using some sort of heuristic when making decisions. And what we find is that about 20% of enrollees choose the cheapest plan available to them. As a result, the plan that is listed first gets a big bump in market share. Okay. As a result, firms have an incentive to be listed in certain places on the website, and policymakers should be aware of the extent to which salience or heuristics affects consumer decision making. Okay, one source of some of the rate shock that you guys heard about earlier is some of the age-based pricing that exists under the ACA, which you've probably heard a little bit about. Now, when we started this project, this was not something that was on anyone's radar screens, and now suddenly people care a little bit more. And what we're going to think about is we're going to think about how age-based pricing in Massachusetts affected premiums for the youngest enrollees in the exchange. Okay? And so how this is going to work is that for a given plan, okay, the oldest consumer in that plan can only be charged under the ACA up to 3 times what the youngest consumer can. In Massachusetts, that ratio is 2 to 1. Okay? Now, this may lead to younger consumers paying higher prices for a number of reasons. Okay? First of all, cost may be different, right? So if you ask the insurance industry what the ratio of cost for a 64-year-old to a 27-year-old is, they'll tell you something like 7 to 1. If you look in the MEPS, it's lower than that, but it's not 2 to 1 either. And so also we would point out that consumers actually have very, very different preferences for what kinds of insurance plans they want. In particular, the thing that the youngest consumers in the plan pay the closest attention to is price, right? Whereas older consumers are much less price sensitive, okay? As a result, firms strategically reacting to that will set prices very differently for younger consumers and older consumers. And what we can show is that both of these effects change the prices that younger consumers face. Okay? So our simulations would indicate that the 2 to 1 age ratios in Massachusetts raise prices for younger consumers by about 22% relative to a market where prices are not regulated in this way. We would also argue that it in fact increases overall welfare because it changes the marginal consumer. Essentially, firms are going to price more closely to something like the younger consumer's cost. Now, in Massachusetts, the mandate was extremely effective, and so it remains to be seen how that will go through in other markets. Last but not least, If I had lots of screenshots and 27 slides, I could show you that Massachusetts changed the way they presented their website. Okay? Now, economic theory would predict that this shouldn't really matter, okay? Unless you think consumers have a variety of behavioral biases. And so what we do is we show that, in fact, the change in the website mattered a lot for the set of plans that consumers picked. And furthermore, we can separate that out from the set of plans that are available and the change in the website. And we find a big effect of the change in the website. What that essentially did is it made the financial characteristics of plans more salient to consumers. So I have a red light, but that's sort of an overview of the kinds of projects we're working on. I'd love to hear what you think and what you guys are interested in. Thank you.